Hello, everybody. I want to welcome you to our webinar today, the topic, an important one, RTI. And we're specifically talking about RTI in Texas and making it work for kids and teachers. So I hope this helps validate some of the things you're already doing successfully, because I'm sure that that is happening, but also maybe some new resources or some new ideas or connections for you. The reason we care about this is in Texas and everywhere else is because we have lots of students, many of whom do need some extra support from us, and having some kind of structure in place, which is what RTI is, helps us, at least theoretically, helps us help these students to have the best success they possibly can in school. And we know why that's important. We could go on and on. I have this one slide. I'm sure some of you have heard this statistic or similar ones. That proverbial third grade level for learning to read. If we're not there by the end of third grade, 4 times less likely to graduate from high school than a proficient student. When we start adding poverty to this discussion, 13 times less likely to graduate. So we really, of course, reading isn't the only thing we care about in RTI, but it is a very important thing. And what we do have some evidence in is that when we are using a structure such as RTI and we do it effectively, more kids become proficient, and that should be helpful to us. So the bad news is that a lot of our students don't quite get where we want them to, but let's have some good news too. Good news includes the fact that we know almost all kids can learn to read. The evidence just keeps coming in that it's about 5 to 7% of students who are going to need that really serious tier 3 level of support, especially if we can get involved with students with effective instruction as early as possible. This is just another way of saying the same thing, that the evidence is very clear that almost all students can learn to read. It's really the students with the most severe reading disabilities that are going to continue to have problems. So we know, I mean, with that bad news and good news, and there's still more good news, because I know some of you work not only at the beginning years of a student's academic career in grades K through 3, but with older students as well. So there's continued good news for our older students. Yes, there is very clearly a recognized optimal age, and that's why we keep talking about trying to get kids up to reading level of proficiency by the end of grade 3. We know that it's never too late, and there's been lots of good research reviews and guides for what to do with our older students beyond third grade. This resource that I put down here is called Improving Adolescent Literacy, but all these ideas work beyond third grade. So it's never too late, but we also know that this is hard work that we're doing. So this little graphic here is what I use to represent me giving some advice along the way. And what we do know, what we're talking about here today, is RTI. We want to be sure that every child who can achieve proficiency levels in reading and all other academic areas do so. And one way to do that, to help do that, is through the RTI process. So since I'm specifically talking about RTI in Texas, I wanted to begin by talking about what's already available. What are the resources for RTI in Texas? So I started at the TEA website, where it defines RTI as an approach that schools use to help all students, including struggling learners. This again is talking about not just reading, but all academic areas. The RTI approach gives Texas students opportunity to learn and work at grade level. So that's a Texas working definition. The basic overarching idea of RTI to help all students be successful. And the TEA website also links to a website at the University of Texas to go a little further into RTI definitions. On that website, they talk about RTI as an instructional framework for all students, focused on the instruction that they receive. It also has relevance in special ed. And here it can be considered documentation of a student's response to intervention that can be used to identify a disability. So that RTI response to intervention is documented along the way. If we are providing effective intervention and still a student doesn't achieve what we want them to do, over time we can use that as a piece of evidence that would indicate that they're not responding because they have some kind of disability for which we need to respond. The goal, as stated by these sources of information in Texas, the goal is to intervene early as possible, and that's generally recognized, as I've already said, good tactic. The earlier we can get involved with powerful instruction, it prevents them from falling behind and can prevent them from developing learning difficulties that can be caused by years of failure and lack of success. So the key elements I see in Texas is using reliable, valid assessments that are given to all students so we can determine who might need some help, what kind of help they need, and if they are in fact making progress. The good instruction is the key. That's the essential component of RTI. Explicit, differentiated instruction, again, talking about all students. And then using whatever instruction or interventions we use, that they would be research-based and targeted to help with specific identified needs. And then I'm very appreciative that Texas noted that professional development is needed to support teachers and administrators. Again, we all agree that what we're trying to do with our students is challenging, difficult, and we need as much support as we can get. So professional development and support, including coaching, which I'm going to briefly mention before. So when I look at what Texas has done to describe RTI and provide support, I would say that's not bad. There are some other considerations that I wanted to address besides those ideas. One is looking a little differently at RTI in terms of its purpose or its goal. And I've come to the conclusion, looking at the research and working with different states that are using some kind of RTI process, is that the real goal can be summed up in the word prevention. In those early grades, what we're trying to do is prevent students from having academic failure, we could say it in the positive, to increase the number of students who are academically successful. I've also here, because that current thinking about effective RTI, that it doesn't just address academics. All of us as professional educators know how closely academics and behavior are entwined. So we want to prevent academic and or behavioral issues from occurring. So that's really the goal of RTI at the early grades. But when we talk about prevention only, or really focus on that, those of us who work with older students wonder, is there any purpose for RTI beyond third grade? And I think there definitely is. And the one word definition or one word goal that I use for older students is that word rescue. If we didn't prevent them from having difficulties, if they show up in fourth grade not strongly reading, successfully reading at grade level, we need to do something about that beyond just accommodations. Accommodations are the wonderful things that we do if we have students sitting in a content area class or a reading class and they can't handle the materials, we accommodate them, and that's a wonderful thing to happen. But if they're struggling because they don't have the skills that they need, the underlying foundational skills, then we need to figure out how to provide that. So find every student, not letting students fall between the cracks, those kinds of ideas for the older students with these core concepts. And you'll see that they mirror much of what was discussed specifically in Texas. We start with instruction. The Texas list started with assessments, and I think that the most successful RTI programs start with the concept of instruction. We prevent reading difficulties with good instruction provided to all students in their core in their core curriculum with the addressing the TEKS, etc. Then comes assessments. We do need assessments for screening, diagnosis, progress monitoring, which we'll talk about. Then doing something about it. If we have spent time collecting assessment data, we need to use it immediately, not waiting. We just really, a lot of RTI has been put in place to counteract that notion of allowing wait to fail. You've probably heard that term, wait to fail, and RTI is a response to that, immediately addressing the needs of students that have been identified in assessment. And here's that PD support and that coaching support. We're doing really challenging hard work, especially when we get past third grade. We've got kids who are behind, we've got kids who are discouraged, they may have developed some behavioral issues. This is tough stuff we're asking schools to do. We need all the support we can get. And then we want to put in the evidence too, that we have the more collaborative we can be with home, the more likely we are going to succeed. Howie Knopf is a school psychologist that writes commonly about his interpretation of research and what he sees in schools. He's saying something that we should be thinking about when we're doing RTI is going beyond academics. And so he suggests maybe expanding RTI, if you will, to something that a lot of states are using to replace RTI, called MTSS, which stands for multi-tiered support system, which incorporates a lot of the good research support of PBIS, the positive behavioral support systems that can be incorporated with an academic support. He says that lots of people are collecting lots of data, but they're not always using it to plan or deliver good instruction. Another concern he raised, and I certainly have seen this, you may be experiencing this in your situation, is that we wait too long. We find students who may have some needs, we put them in tier 2, keep them there for too long before they qualify or have access to more intensive services, or keep students in an ineffective tier 1 before we allow them the access to the supportive support that they might receive in tier 2. So his point, a student in need should be considered immediately without a certain number of interventions or a certain number of weeks. And I have definitely seen that before. I share that concern. They should not have to fail in tier 1 before then go into tier 2 and fail to qualify for tier 3. If we can find students who's very clear they need the most intensive services, we should provide that from the very beginning. Of course, when we talk about whatever, we talk about RTI or MTSS, there's going to be some sort of triangle or pyramid or something. I personally have gotten a little bit tired of triangles and pyramids, so I turned it on its side to create this wedge, the RTI wedge. But it's simply, we use triangles or wedges to represent the idea that if we have an effective RTI program, we're serving all students in tier 1, no matter what their needs. Some students, and the research says it's approximately 20 to 30%. If the core instruction is powerful and effective, we're going to have 20 to 30% of students who need some additional assistance because of lack of background, mild learning disabilities, they may be EL students. They're going to need some kind of extra support to succeed in the regular classroom. And then, if all those things are working really, really well, we do have schools where there are only about 5 to 10% of students needing the most intensive intervention for tier 3. Another reason why I use this graphic where I've turned the tiers on their side is so that I can really emphasize that arrow across the bottom, which is meant to represent the things we should be thinking about that increase. So we hope, if everything's going well, the numbers of students in each of the tiers decreases. But what's increasing is the amount of instructional time that students receive. Students in tier 3 are going to need more time in instruction than students in tier 2 or tier 1. The intensity of the instruction should be increasing. Intensity is increased by narrowing the focus of what we are trying to teach, as well as making the group as small as possible. The amount of data collection, we just don't need as much data on our successful Tier 1 students. We need to inform our decision making. We need more data on Tier 2 students or students receiving Tier 3 services as well. And the amount of expertise, and not saying at all that our very, very best high quality teachers should not be in Tier 1, because that's exactly where we need them. When we're talking about increased expertise, I mean that to talk about the evidence that we have that we need to do more collaboration. We need classroom teachers collaborating and working with our reading specialists, our coaches, and others. When we get to Tier 3, we need our classroom teachers and our special ed teachers with school psychologists and social workers, speech pathology, all those kinds of things. More expertise, more brains at the table, if you will. Those of you who work with older students in middle school and high school, the tiers really do look different, because all students, we don't have core instruction in the same kind of way. So this model is to acknowledge that. Some things that have been found effective for RTI in middle school and high school is our content teachers really collaborating around a similar set of processes and materials, extensive PD and support for those teachers. For Tier 2, reading, most of the students needing Tier 2 support in middle school or high school need some kind of reading instruction. The research is indicating a minimum of 50 minutes a day, the smallest class size possible. I mean, we can recommend 1 teacher to 10 students. In the reality of our real classrooms, we might not be able to do that, but it's a suggestion for these students who are behind. And for middle school and high school in reading, it's going to be a grade of age-appropriate decoding instruction, fluency instruction, and or comprehension instruction. At least 50 minutes a day for our Tier 3 students, the smallest class size. They may need, along with decoding, some spelling, fluency, and possibly some language supports as well. So let's get specific on what we're talking about. My colleague Carolyn Denton and I, a few years ago, did a review of research on effective schools and found that the most effective schools pay very close attention to standards. They have a system in place for collecting good assessment data. It supports effective instruction and intervention. Leadership and sustained commitment are the components of our sales model. For today, the brief time we have together, I want to focus in on the assessments and a step-by-step outcomes-based model that has been proven to be effective. So all schools that are using effective RTI should start with a process. This is really the purpose of not allowing any students to fall between the cracks. Texas model says RTI is about all students. So we first have to have something in place to help us identify which students might be at risk. So using that RTI model, I've been discussing the idea of assessment collection, following the model provided for us by our colleagues in the medical world, who use assessments at 3 different tiers. And the physicians I've talked to don't use the term Tier 1, Tier 2, and Tier 3, but they acknowledge that they differentiate in the assessments that they use for patients like our students who are at different level of need. So minimal data collected for those of us who are lucky enough to be fairly healthy. We might see the physician once a year. Everybody gets a certain set of assessments, universal screening, blood pressure, height, weight, body temperature, cholesterol levels. Everybody gets that. In the next category of patients, there's a different type of assessment used, diagnostic assessments, that are very specific to the presumed needs. So a physician might take an x-ray of someone's arm or a biopsy of their liver, or a CAT scan of their lungs, very differentiated in order to come up with a good treatment plan. Once in tier 3, that might be considered in the medical world somebody who's in the hospital in intensive care. And there, the data, we hope it's very few people, and usually in the medical world it is, but the monitoring, the data collection goes high as possible. It's often 24/7, where a team of people are working together to collect very frequent data for the purpose of monitoring how the treatments are working, hopefully to get this patient out of intensive care and back into tier 2 level of treatment, eventually back to health and wellness in tier 1. So we found that in our review of effective schools that most of the highly effective schools are following that kind of medical model. They do a screening process. Some kind of assessment is administered, usually 3 times a year, beginning of the year, middle of the year, the end of the year. The student scores are compared to a benchmark. If they are at or above benchmark, we can consider them likely on track. Students who are not at benchmark might need extra assistance. This kind of assessment is administered to all students and often referred to as universal screening. In middle school and high school, there isn't a test that we would give to all students. It's kind of silly by that point, but the highly effective schools do have some kind of process. One that I have seen effectively work is that 3 times a year or 4 times a year, someone designated as the homeroom teacher takes the responsibility to see where students are, looking at grades, particularly any grades in English language arts, if there are behavioral referrals, test results, that kind of thing. If students are looking like they might be at risk for failure or at risk for lack of academic success, the homeroom teacher brings up this student with the data that they've collected with with a team, which is there to determine what are the next steps. And often the next steps should be, in fact, diagnostic assessments, which is in this outcomes model, step 2. Once we found a student who might be at risk, the first part is to determine students' special needs, which we would call diagnostic assessment. So part of the handouts that I have included for possible download for this session include this diagnostic sequence, which is all about helping teachers in real-world classrooms do as little assessment as possible. Get in, get the data you need, and get back to teaching. So we recommend starting at the bottom of this sequence. If you are working with students in kindergarten or first grade, you do some quick assessments of phonemic awareness, sight words, and some kind of spelling inventory. And if the student is where you expect them to be, they're in fact not that low on these things, you could go up even at those young grades and check out some of the phonics and decoding. However, if a student is low or below where you expect them to be on any of these areas, we suggest stop testing. No more testing, and instead start teaching. Look at the foundational skills that the student might be missing: blending, segmenting, sight words. For some students, it's actually going to be language, which is the missing piece for them. For our older students, starting in grade 2, we suggest doing some kind of informal reading inventory, which is simply asking them to read a passage that has some questions associated with it, checking their fluency as they're reading, what is their accuracy and rate levels, and that can give you a lot of information. If the student on an informal reading inventory is where you expect them to be, they can read and understand grade level text and they do that fluently, no more assessment needed. Stop and continue with appropriate instruction. When we do find a student at these older grades, starting grade 2, not all that old, but if they're not where we expect them to be, then going down this chart and definitely checking their phonics and decoding to see if that might be the issue. So in step 2, the second part of that is we use the results from this diagnostic assessment to actually plan the instruction. And focusing instruction, this is some more guidance from Howie Knopf that I think is very helpful. Once we found students at risk for reading in or other areas in elementary school, it's the academic foundational skills that we need to be looking at. Is it language, phonemic awareness, decoding, vocabulary, numeracy, calculation? Target the intervention that we're going to do. By secondary, we do also need to follow up and see if it is foundational skills for these students, that they have those. Too often for our older students, we just jump in with comprehension interventions, but comprehension interventions aren't going to work if the student is lacking some of the foundational skills, such as decoding and fluency. We also want to emphasize collaboration around this. When we're planning instruction, we're talking about kids who have failed, often failed for years and years. Each one of these teachers, if they had that student, may have done the absolute best they knew how to do. So we've got to increase the expertise, increase the brains at the table to make sure we're doing the very best we can. This framework for planning is something that you might consider to help things be more systematic around planning, because it's a missing piece. Teachers are working so hard and doing the best they can, but often just reaching for the materials or the computer program or the whatever that they've used before that may or may not have been successful. So we have to rethink this. So we've taken this work, this framework for planning, and actually created a little rubric that's available at the website of Gibson, Hasbrouck and Associates, GHA, that's what that stands for, Gibson Hasbrouck Associates -PD. That's a website that my colleague Vicki Gibson and I have set up with professional development support materials, including these resources. So you might take a look at that if planning instruction based on good data is a missing piece in your RTI program. Step 3 in this process, okay, we've come up with a plan based on good data, and now we teach. That's my super teacher graphic right there. And we're going to teach with support, I hope. Teachers just being told, okay, now go do this. Take this student who is struggling academically and fix them somehow magically. We need support. We need to provide teachers with support, including right off the bat there, high quality materials. It's really, really hard to meet the needs of students, differentiated needs of students when you don't have good materials to work with. All of us, when we're dealing with any student, can benefit from PD support, but certainly when we're working with our most struggling students academically, behaviorally, and coaching as well, for making sure that a teacher has somebody in there who can come into their classroom, who can watch them teach, who can model some good ideas, who can connect them with someone else in the building who may have addressed this issue successfully before. This is I've said it so many times, but again, this is just so hard, so challenging what we're doing, and so important, and it is doable. We just really need to pay attention to that research that says almost all kids can be successful academically in school. We need to help us get there. So I've implemented the plan. I've got a student doing something that I hope is the best possible thing for the student. It's my responsibility to monitor their progress in the same way that a physician would do that. Our sales model says that the very best schools continuously evaluate their students, watch their daily performance, collect assessment data, and then once we have monitored their progress, we're going to look at that data, and we're either going to make the changes that, because the student isn't making sufficient progress, we're going to adjust what we're doing a little bit, make some changes, perhaps with support from a coach, because what we're saying, if a student is not making success, we do have to change what we're doing. So one of the, we have to modify what we're doing, but we've created this checklist here to talk about some of the things to consider modifying. Maybe we're using a superb instructional material or website or intervention, but it's not what this student needs. So maybe the match is what's not working. Maybe we're not using the best quality program or instructional methods. Are we using an excellent program that should be working for the student, but perhaps we're not using it with fidelity? We're not using it in the way it was really designed to be used. The intensity of the instruction, as I mentioned before, well, one of the things that can be done to increase the intensity of the instruction is to try to get that class size down a little bit smaller. Maybe we're focusing, if we have 50 minutes or 55 minutes a day, maybe we're trying to focus on too many things. Maybe we should refocus what we're spending that time on. The duration of the instruction, we haven't shown any progress yet, but if we keep going a little bit further, maybe we will see a match. So we've taken, once again, the research-based suggestions for modifying instruction and created a rubric available at the GHA-PD website under resources. So if this is something that would beef up or support the work that your RTI team is doing, you look at kids who are not succeeding as well as they should, maybe taking a look at this checklist for some ideas of what changes could be made. If the progress monitoring in step 4 actually shows that the student is making progress, then step 5 is to just continue the plan. If we do make changes, then we return, as this rubric shows, this diagram shows, we return to step 3 and come up with a new plan and implement that plan and continue to monitor progress and continue to support each other. This is just challenging what we're doing. So the other thing that we found in the sales model was that highly successful schools not only just collect this assessment data to screen and diagnose and monitor continuously the progress of their students, they do two things that are noteworthy. One is that they share the data. The teachers work together. They look at the data in meetings that are fairly frequent. When we're first starting to work with a school that wants to improve their RTI outcomes, we suggest meetings at least 3 times a year, beginning, middle, and end of the year. Many schools, the most successful schools, meet more frequently than that. I'm volunteering at a K-8 school that has an RTI process. It's actually an MTSS process because they do include behavior. And they meet every 5 weeks, with each grade level. We look at data, we look at just teacher report, how they're doing, any behavioral, social, emotional things that have arisen, and talk about what we might do to help that student. So the meetings have to be frequent, public in that this kind of hard collaborative work that we're doing is better done when we have more brains at the table. So not just taking performance data and giving it back to the classroom teacher, but by public meetings we mean that there are other teachers. If we're talking about a 3rd grade classroom, a 3rd grader, we want all the 3rd grade teachers at the table. And I know some of you may work at schools where there's only one 3rd grade classroom, but bringing other people to to the table. The school where I'm volunteering, the principal and the vice principal are there at every meeting. The counselor is there at every meeting. The special ed teacher is there at every meeting. The reading specialist is there along with the grade level team. And having all those brains at the table just help ensure, not that we're magically going to come up with the right answer, because we don't always, but that once again, that goal of no child falling between the cracks is better, and we can support each other. These meetings have to be non-judgmental. This is not about finding who's the best teacher at any grade level. When we do find a teacher who's having great success at a grade level, we want to tap into his brain or her brain and find out what they're doing so we can all copy that and we'll all be that successful. But these meetings are about kids, the kids' performance, not judging good teachers or bad teachers. The tone needs to be very focused on the student and how can we, in our system, do the best job we can to support these students. So the tone of the meeting has to be collaborative. So that's one thing I would highly recommend if you're not doing some kind of group sharing and analysis of student performance data, that you consider doing that using this meeting, and then actually doing something. That is something that the school I'm working with is focused on, because they say we're really good at having these meetings. We sit around and talk. We're collecting good data. We think we are anyway. But what's the next step? What do we do to make sure that things are different? And that's where this year I hope to bring in that checklist of modification. Here are some things that we should think about. What are we going to do differently? Because what we're doing now, just for whatever reason, isn't working. So if this image can get into your head, a group of teachers collaborating around data, information that they have regularly, sharing, discussing, and using student data can make a world of difference in the outcomes of our schools. So I mentioned that I was hoping to share some resources with you as well. So if you are doing RTI, or if you are in charge of a leadership position in RTI, that you're already familiar with these websites, because they have a wealth of information, often much of it research-based, but a lot of it tested and proven by teachers themselves, very classroom useful information. I put a star and highlighted the website, the National Center on RTI. That is a federally funded website with a rich source of information for RTI projects or frameworks, not only at the elementary level, but middle school and high school as well. The last one on that list is there only because it's the most recent one I've discovered. I am incredibly impressed by what the state of Michigan is doing with their RTI. They call it an integrated behavioral and learning support system. They do use the acronym of MTSS, but many of the tools and processes that they've developed, I think, are outstanding. And I just, okay, this is the last time I'm going to say this, but what we're doing is so challenging, so hard. We can't be asked to reinvent the wheel. Everybody trying to figure this out on their own. So I'm very focused these days in my work of finding people who are doing great stuff and just copying what they're doing, making sure that we are using the very best resources. In fact, one of the Michigan resources is a tool that I've shared with lots of different schools, is a tiered inventory at elementary and secondary level. So this is specifically around reading, but it is a way to evaluate the effectiveness of the implementation of your tiered support system, RTI, MTSS, whatever it is. Very, very detailed. They have done a lot of field-based research on this. I just would find, if I were leading a tiered response in a school, I would want to be sure that I haven't missed any of the pieces, that we're not wasting our time. Getting a hold of these on that website, the Michigan website, I think would be a very useful tool for most schools doing some kind of RTI. So I'll wrap up with that, and thank you very much for your time. This has been a very quick overview of what RTI is specifically in Texas, but some additional thoughts and ideas about what can be done and some additional resources. I want to thank you all as professional educators, as my colleagues, for the work that you do, and I hope that this has been useful for you. So just checking to see if there has been any questions, and I don't see any. Please feel free on this last slide. There are two websites, Gibson, Hasbrouck and Associates, as well as a personal website that I maintain. If you have any follow-up questions or concerns, or great ideas to share with me, or resources that I'm not sharing yet with people, I'd be very grateful for that. So again, thank you so much for your time. Thank you so much for the work that you do with our students, and have a great year.